If you're a caregiver for an older adult with diabetes, you already know it can feel like a game of numbers, right? You're constantly tracking blood sugar readings, carb counts, medication doses. But the real story, the one we're going to talk about today, is what happens when those numbers aren't managed over time. So, let's dive into the top 5 diabetes complications and, more importantly, how you can proactively protect the person you care for.
And first, let's just get a handle on the scale of this. Nearly 30%. That's more than 1 out of every 4 Americans over the age of 65 who has diabetes. This isn't some rare thing. It's a huge challenge that millions of families, probably a lot like yours, are navigating every single day.
And that really brings us to the whole point of this explainer. The idea here is, and I quote, not to frighten you, but to empower you. Because honestly, knowledge is your single most powerful tool. It's what turns worry into action and helps you prevent serious health issues down the line.
All right, so here's our game plan. We'll start with a quick look at why this is such a widespread challenge. Then, we're going to break down exactly how high blood sugar actually causes damage. After that, we'll cover the big ones, heart and brain risks. Then move into other really critical issues like falls and medication management. And we'll wrap it all up with a proactive care plan you can start using right away. Okay, section 1. Let's start with the big picture. You know, the complications from diabetes are so serious because they basically open the door for other severe medical conditions. It's like a domino effect. And your job as a caregiver is to be the one who stops those first few dominoes from ever tipping over. So, how does all this damage actually happen? It's so much more than just a number you see on a glucose meter. There's a physical process happening inside the body. Let's pull back the curtain and look at the core mechanics of the disease.
So at its most basic level, diabetes just means the body's system for using fuel has a problem. Think of sugar, or glucose, as the fuel. And insulin, that's the key that unlocks our body's cells to let that fuel in. With diabetes, there just aren't enough keys to go around.
And here's how that plays out step by step. A person eats, and their blood sugar naturally goes up. But if there's not enough insulin, not enough keys, that sugar gets stuck outside, just floating around in the bloodstream. It can't get into the cells where it's actually needed for energy. And over time, all that extra sugar acts kind of like sandpaper inside the blood vessels, causing damage from the inside out.
And as you can see, that damage can pop up almost anywhere. We're talking about the tiny blood vessels in the eyes, which can lead to vision problems, the delicate filters in the kidneys, the entire network of nerves, and of course, the heart and blood vessels themselves, even gums and teeth. The takeaway here is that managing blood sugar isn't just about how someone feels today, it's about protecting all these vital systems for years to come.
Okay, now let's get specific. We're going to start with 2 of the absolute biggest risks, what diabetes can do to the heart and to the brain.
The first major complication we've got to talk about is heart disease. The research on this is crystal clear. People with diabetes are way more likely to have heart disease or a stroke, and it often hits them at a much younger age than people without diabetes.
So what can you do? Well, this is where you get to put on your detective hat. Next time you're with a doctor, ask them directly. Based on my loved one's health, what specific type of heart issue should we be most worried about? Get them to be specific. Then go home and learn those symptoms. That way, if you see something, you'll know exactly when to sound the alarm.
Now, the second major risk is the connection to the brain. And this statistic, it's just staggering. Patients with diabetes are twice as likely to develop Alzheimer's or another form of dementia. Twice! The link between blood sugar and brain health is just becoming too strong for anyone to ignore.
Your role here is really about observation. I mean, you know your loved one better than anyone. So if you start to notice strange memory lapses, confusion, or just behavior that seems off, don't just brush it aside. The absolute key is to get a full evaluation done as soon as you can. An early diagnosis might not be a cure, but it makes a world of difference in improving quality of life with the right treatments and planning.
Okay, so moving on from the heart and brain, let's talk about some other critical risks that really impact day-to-day safety and well-being. I'm talking about falls, medication problems, and a few others.
So, diabetes can really mess with nerve function, especially in the feet. This can lead to numbness or pain. It's a condition called neuropathy. When you combine that with other issues, it can make just walking and keeping your balance a lot harder. And the result? A much, much higher risk of dangerous falls and fractures.
But here are 2 simple, powerful things you can do about it. First, make fall risk a regular part of the conversation with their doctor. Ask for an evaluation. Second, take a hard look at their home. Are there loose rugs?
Is the lighting dim in the hallways? Is there clutter to trip over? Making their home as fall-proof as you can is one of the best preventative moves you can make.
All right, the fourth big challenge is just managing all the medications. I mean, it's rarely just one diabetes pill, right? It's usually that plus something for blood pressure, something for cholesterol, and pretty soon you have a whole cocktail of drugs. This creates a huge risk for bad side effects and dangerous interactions.
And to put a number on that, it's really common for seniors with diabetes to be taking 6 or even more different prescription medications. Just think about that for a second. Trying to juggle 6 different pills, all with their own schedules and side effects, it's an incredibly complicated job.
This is where you have to step in as the medication manager. If you notice any new side effects, dizziness, sudden fatigue, confusion, call the doctor right away. And at least once a year, ask for what's called a brown bag review. You literally put everything, prescriptions, vitamins, supplements, everything, in a bag and have the doctor or pharmacist look for potential problems. It's so important.
And finally, just keep an eye out for these other related conditions. Things like depression, changes in vision or hearing, or incontinence. They can often be connected back to diabetes and its effect on the body's nerves and blood vessels. So try not to see them as separate problems, but as potential clues to the bigger picture of diabetes management.
Whew. Okay, we've just covered a lot of risks, and I know that can feel a bit overwhelming. But now let's pivot to the most important part, your power to make a real difference. This is all about shifting from just reacting to problems to proactively preventing them.
I want to end with this really powerful idea that I hope you'll take to heart. Every time you help prepare a healthy meal, give a medication reminder, or encourage a short walk, you're not just managing a condition. You are actively protecting their future. You are the guardian of their vision, their heart, and their independence. What you do is absolutely invaluable. So I'll leave you with this question to think about. After everything we've talked about today, what is one tangible, proactive thing you can do this week? Is it scheduling that medication review? Maybe it's buying a brighter nightlight to prevent a fall. Or just writing down that question about heart disease to ask the doctor. Whatever it is, let this knowledge turn into action. You've got this.